Okay, so we're going to place a femoral arterial line. We have designated this site as the best access for this patient. And so we have prepared the patient, we have draped the patient, we've also placed the tools in accordance with the flow of the procedure. This is to maximize the workflow of the procedure and minimize hand movements. Okay, so that's certainly one key part of this. We've also prepared the ultrasound probe, and we are good to go for placement of a right-sided ultrasound-guided femoral arterial line. Okay, so first we want to visualize. The femoral artery and common femoral vein side by side. So the pattern from lateral to medial is navel, nerve, artery, vein, empty space, and lymphatics. So we can see here the artery is to the left of the screen. So that's what we're going to be infiltrating over, and we want to have it so the artery and vein, they are a single circular structure side by side. If the artery bifurcates, you're a bit low, and it would bifurcate into the superior and deep femoral artery. Okay, so let's go ahead and infiltrate the site with local anesthetic. And we can use ultrasound here to guide our procedure. That's great. I can see here you are aspirating as you go, just to make sure you don't get any blood back. This should be all in the soft tissue. And normally once I actually infiltrate with lidocaine, I take the needle out and I place some pressure with some gauze over the site. That way it distributes the lidocaine and gives you your anatomical landmarks back. Otherwise, you may have a bleb of lidocaine, which reduces the landmarks. Excellent. Okay. So to go through the kind of next steps of the procedure, we're going to give it, a minute or two here for lidocaine to work. So let's just go here through the steps. If you can drop the probe for a second. Just show me the finder needle here. Okay, so this is not going to have a syringe on the back. We're going to insert that to the point that we get a rooster tail, okay, or a nice arterial pulse flashback coming back. And then we're going to insert the wire. And so it's nice to have that wire prepared, ready to go. That way you can easily advance it. Okay, and then once that's there, the wire's in, the needle comes out, then you can advance the catheter. Yep, in there. And then finally, once the wire's out and the catheter's in, we can suture that to the skin. So let's go ahead and start the procedure. Perfect. There we go. Nice visualization there. So we have the vessel in the middle of the screen and the needle in the middle of the probe. And about 45 degrees right on top. We'll use the creep technique here. We can see our needle tip as it's going down. That's excellent. I think we're very close. I think we're pretty much on top of the vessel. So we're watching the screen and we're watching the syringe to look for that arterial flash. There we go. Okay, we have arterial flash. Now advance the wire in there. The wire should pass nice and smooth. And let's make sure we leave enough wire. We're watching the wire at all times here. Okay, so the wire's in. Now the needle can come out with the apparatus. We don't dilate here. We just insert the catheter over. So we'll insert the catheter over, always watching the wire and keeping your hand on the wire at all times. Threading the needle in the catheter is regarded as one of the next hardest steps in the whole procedure. Okay, so we're advancing the wire here to watch as it comes out the other end. Okay, that way we can advance the catheter and never lose control of the wire. Okay, now we'll pass the catheter. We're watching the wire here. You can also keep your hand on the wire. That way when you advance, you don't lose track. Okay, here we go. So now what we'll do is take the wire out. We can cap the line here, and that way we can suture it in. And once it's sutured in, we can attach that to the transducing apparatus. Okay, good work here. That was a difficult procedure. I think what we experienced there was a bit of rolling of the artery. Maybe there's some calcium on top of it. Okay, nice. So yeah, I want to make sure it's nice and sutured well, that way it doesn't get yanked out. I'm not sure if you have a wipe there, do you? Or sorry, not a wipe, a dressing. I'll get it for you. What, dressing? Nearly done. Just a arterial dressing.
Okay, thank you.
Mr.
I like listening to your teaching voice. Blue boy.
Tis,
Blue boy.
tis my teaching voice.
It is your teaching
Tis.
voice.
Yeah,
Well, and you have the dark blue eyes to go with the blue ensemble.
that's right. Oh, thank you. That's great. Okay, so we'll just clean off the site here, and then we'll apply the dressing. Okay, so we're making use of that saline flush, which is great. Okay. So this is a chlorhexidine impregnated dressing we're going to apply over the arterial line site. So we'll apply the jelly pad area to the point of entry. Okay, and have the tubing come out of that split part in the middle. There we go. Excellent. Okay, and if you want, there are some strips there if you want for some added security along the sides of this dressing. Perfect. Excellent. Now we'll get you hooked up and connected. Okay, if you want to connect this to the arterial apparatus, okay, I'll pass you it here. There we go. Okay, and that completes the procedure. Thank you. Bye for now.